My name's Jonathan Moreno. I'm a member of the National Academy of Medicine and emeritus professor at the University of Pennsylvania in Philadelphia. I have been a kind of following the committee and its work for years, and I let the leadership know that I wanted to be a member as soon as a spot opened up, and it finally did. I was interested in human rights issues, grew up in a home in which civil rights was a big topic, and traveled a lot with my parents around the world and saw the ways that different governments, different social systems, different regimes treated human beings. When you think of STEM, what is the connection to human rights? Science, technology, engineering, math. These are fields that have prospered, have flourished in the last 200 or 300 years. I would say directly because they are products of the Enlightenment. And in the Enlightenment, the attitude of the Enlightenment philosophers in the 17th century and the early 18th century was that there's such a thing as natural rights, that people can change the world. You don't have to take it as it is. And how can you be smart about changing the world to make it better than it is? Well, you have to understand it. You have to gather evidence and information about it. In order to implement the evidence and the information, you have to be able to talk about it. You have to express yourself. The right to free expression is a fundamental human right that comes out of the Enlightenment because this connection between science and the ability to change the world and the notion that it can be improved, which is an idea that we sometimes feel like we've lost. It is kind of a unique responsibility that healthcare professionals have. I like to say to my medical students, you have rights that are given to you by society to touch people physically and emotionally, and that's a special role. And that requires a sense of humanity. It's also true that scientists can produce important innovations that can also undermine human rights. Unfortunately, not everything goes well, right? Not all science and technology improve the human condition. Not all of them help us to respect the rights of individuals. So there is a level of responsibility that people in science and technology and engineering and medicine have to think through what they're doing, why they're doing it, and what its implications and consequences could be for human rights.